Promotional support for Pulse on Health is provided by Lawrence General Hospital. So good, so caring, so close. Digital Federal Credit Union. DCU is a not-for-profit financial cooperative owned by and operated for its members. Arbella Insurance Foundation. Committed to supporting local, nonprofit organizations that work hard to positively impact the lives of the people of New England. Enterprise Bank. Create success. Gemline. On trend, on time, on budget. And by the Hayes Companies. All together, certain.
Welcome to another edition of Pulse on Health. I'm your host, Mark LeMay. August is National Breastfeeding Month, a time to promote the importance of breastfeeding. According to the Centers for Disease Control, 83% of the infants in the United States receive breast milk at birth, while only 25% receive it at 6 months. Joining us today on today's edition of Pulse on Health, Dr. Jennifer Summers, a family physician and lactation consultant at GLFHC. Welcome, Doc.
Hi, Mark.
What are some of the facts behind the benefits of breastfeeding an infant?
So there are a lot of benefits for breastfeeding for infants, and in particular, it prevents infectious diseases for babies. So it reduces colds, ear infections, GI bugs, and in some cases, it can even save lives. It also prevents more chronic diseases such as asthma, leukemia, and diabetes in children that have been breastfed. And then for moms, there are some benefits too. It decreases the risk of breast cancer in their life and also decreases the risk of obesity and diabetes.
Fewer ear infections, fewer respiratory infections, fewer allergies, lower rates of SIDS, just some of the benefits that you know. Do we know why?
We think, well, it's kind of multifactorial. The SIDS one is a little confusing and we're not sure exactly why, but we think that in part, the decrease in the rates of SIDS is related to the decrease in the rates of infection. So we know that the antibodies that mom provides to babies in breast milk protects babies from infections. So that's part of it. The other theory, and this is just a theory, is that babies sleep with less deep sleep if they're breastfed, but they still sleep the same amount. A common myth is that breastfeeding babies don't sleep as well as formula-fed babies, but they still sleep the same amount according to some studies that have been done. But they sleep in a different stage of sleep, less deep sleep and more REM sleep. And so that more REM sleep may prevent them from sleeping so deeply and forgetting to breathe. But we're not exactly sure. That's just a theory. But most of the protection is related to the antibodies and the components of the breast milk.
What is colostrum?
Colostrum is early breast milk. So it's the milk that comes out before true lactogenesis. And lactogenesis is a big word for the milk coming in.
I was going to say, that's a big word, Doc.
But colostrum is a little, it's full of vitamins and minerals, in particular vitamin K and other kind of fatty lipids that help the baby sort of equilibrate or become alive, right? Like there's that process of the baby coming out, and then the colostrum gives this, like, I think of it as like protein gel. Instead of like actual food or like milk, it's like just a really heavily fortified, strong substance that has a lot of vitamins. It has some protein, and it has a little less fat and less carbohydrates than regular breast milk.
Is that why it's called, in some cases, liquid gold?
I think so, because of all those vitamins that it has in it.
How does breastfeeding compare to formula feeding when it comes to a baby, whether it's a newborn, year old, 2 years old? How does it compare?
Um, I think it's really important to like remind everybody that even though breastfeeding has a lot of benefits for moms and babies, formula is still a life-saving medication. If for some reason the breastfeeding isn't working out, formula is still good food for babies. But the difference in breast milk compared to formula is that the formula is like a substitution. They're trying to mimic what is in breast milk, and they just can't do it, right? Because you can't put antibodies in, you can't put other hormones in that come in breast milk. And so breastfed babies tend to grow slightly differently than formula-fed babies. They don't grow quite as, I don't know how to describe it. They grow a little slower and they put on a little less fat in the first year of life, but they still tend to like catch up by 4 months and then grow normally from there. And I should rephrase it because we want to rephrase breastfeeding as being the norm, like that's the normal for human beings. So breastfed babies grow at a rate less quickly than formula-fed babies in the first 4 months, but that's probably safer and healthier for their metabolisms.
What about benefits for mom?
So as I said before, benefits for mom are reducing the overall lifetime risk of breast cancer. And I think about this as like sort of the biological thing for breasts to do is to create breast milk. So if we allow them to do that, that might reduce the risk of developing cancers later in life because those cells have been used for the form that it was designed for. And then the other benefits are related to sort of metabolism postpartum. So women who breastfeed tend to not gain as much weight after they have their babies. And they also tend to have lower blood sugars.
One of the questions that I had on my mind before we started the interview was, I want to say, the trend of moms selling breast milk. Is that good or bad?
Well, I kind of think selling is probably not the best use for breast milk. I recommend instead to give it away. There are quite a few donation centers for breast milk, including the Northeast Breast Milk Bank. And that will actually provide breast milk for moms who need it and can't supply their own. And that breast milk is pasteurized and made sure that it's safe. And they also use that breast milk in NICUs, so in neonatal intensive care units, to help babies who are born very premature.
So, and maybe I'm getting a little too technical here, but when you say it's pasteurized, breast milk has the antibodies from mom, and those antibodies are passed on to the child. But if it's not your child that you're giving if you're giving someone else's breast milk to your child, are you passing on different antibodies, or does the pasteurization take care of that?
So the pasteurization actually destroys or denatures some of the antibodies that are in breast milk. And the biggest benefit of breast milk antibodies are, for example, if me and my baby get sick at the same time, but I've had this cold or something like this cold before, I will make antibodies really quickly to this cold and then pass them to the baby, which helps the baby fight off this cold. And the baby has probably never had this cold before. So you're right in thinking it's not as helpful to not have mom and baby's antibodies together. But some of the other components of breast milk, like the lipophilic proteins and the vitamins and the minerals, are all preserved through the pasteurization process.
And that brings me to what my next question. I'm guessing this milk group, this milk depository, helps moms who can't breastfeed for whatever reason. Maybe the child doesn't take well to mom can't express milk. What are some of the other reasons why a mom may not be able to breastfeed? And does this depository of sorts help those moms out?
Yes, it's called Mother's Milk Bank Northeast. I just wanted to make sure I got the exact name for the local area. And so there are some reasons why we don't recommend breastfeeding. One is HIV infection in the United States. We recommend against breastfeeding here. In developing countries, as long as the HIV is well controlled, there's some benefits to giving the baby breast milk because of the other contagious diseases that they can get, but the benefits are not proven to outweigh the risks in the United States. But, there are other reasons too, breast surgeries, history of breast cancer, or maybe you're taking a medication that isn't safe with breastfeeding, or you adopted a child, or any other those reasons. The Northeast, the Mother's Milk Bank Northeast is a place to contact to see if you can get breast milk through them.
And I'm guessing, and feel free to correct me if I'm wrong, but this breastfeeding or formula feeding dilemma really happens in first world countries, the U.S. Being one of them. In third world countries, I'm guessing formula may not be an option.
Unfortunately, formula companies have really marketed their products in all areas of the world. And formula can be dangerous in areas of the world where water is not safe, as one can imagine, because the GI bugs that get passed through water can be very dangerous to infants. But I think you can get formula almost anywhere in the world now, even though it's much safer to breastfeed in some places.
Is there a typical age for a mother to stop breastfeeding?
Usually they say the goal is 6 months to a year. So the American Academy of Pediatrics recommends up to a year. The reasons for that recommendation is that babies who are breastfed until they're 1 year old tend to get, moms tend to be sick less because their babies are sick less. And so there's benefits to both mom and baby for that first year of life. After that, the American Academy of Pediatricians and the American Academy of Family Doctors recommends for as long as mom wants. So after that, it's kind of up to everybody, up to individual choice. There probably are some benefits to breastfeeding toddlers, again, for the same reason that I said before of reducing illnesses, especially URIs and GI bugs.
All right. We're talking with Dr. Jennifer Summers, family physician and lactation consultant at GLFHC. Our topic in this edition of Pulse on Health is breastfeeding. We'll come back with more right after this. Welcome back to this edition of Pulse on Health. I'm your host, Mark LeMay. Our guest today, Dr. Jennifer Summers, family physician and lactation consultant. Our topic today, breastfeeding. And August being National Breastfeeding Month, it's a perfect time to bring up the discussion. Doc, my next question, are there any disadvantages or side effects to breastfeeding?
As I remember, I was often very hungry when I was breastfeeding. So you can feel kind of hungry, and there are consequences in the sense that sometimes people develop breast pain or breast discomfort or this and that. But overall, the health benefits, if we're talking about a population, outweigh the risks and the discomfort. Unfortunately, individuals, though, it can be uncomfortable for them.
Is there some truth to the point that what mom eats, the baby eats?
I think there's a little bit. There's a little bit of truth to it. Sometimes, babies can't really tolerate dairy products in breast milk. Other times, like my kids didn't seem to particularly like it when I ate a lot of broccoli.
There you go.
There
There's
you
your sign.
go.
Has the stigma of breastfeeding in public gotten less through the years?
I certainly hope so. I think it depends a little bit on where you live. It still can be kind of difficult and uncomfortable, but in Massachusetts, it's legal to breastfeed anywhere. So that's important to know. So it is a protected right for women and children. I do remember when I was breastfeeding my oldest child, my best friend in the world asked me, we were sitting at a restaurant, wouldn't I rather go breastfeed my child in the bathroom? And I looked at her and I was like, would you like to eat your breakfast in the bathroom? So it still is out there a little bit, but I'm hoping it's getting better.
Have employers done a better job about allowing women to express while on the job?
Again, that's a legal right. For women, they're allowed to take breaks to express breast milk. Although it can be like a little bit intimidating to negotiate those things with your employer. So I think, yes, in general, it's better, but I think we're still kind of working towards a better situation.
I know GLFHC has specific rooms, maybe an office that is designed to give moms a better place to breastfeed other than the bathroom. And have we at least made better strides than that?
I think we are. I really do think we are. I think we need to be careful that we don't make things almost more punitive. Sometimes what happens is like you can take a break to express breast milk, but you might lose your lunch break, or you might have to go home later to make up that time. And I think that it's just important to continue to advocate, because it's not really fair for a working mom who's, trying to pump for her baby, and we know it will protect her time at the workplace because her baby will be less sick than other children. So I think like framing it like that this is really good for your employees. This is good for their health. This is going to keep your employees coming back to work, and making sure that they're not made to make up time or, miss their lunch break.
Is it okay to bottle feed and breastfeed a baby?
Yes, especially if you need to. I mean, it's a fed baby as a healthy baby.
Okay, that makes sense.
Yeah.
When should a mom not breastfeed her child?
As we talked about a little bit before, the only times that we recommend against breastfeeding is HIV infection in the United States. And also if a mom is taking a medication that is not compatible with breastfeeding. And most medications are, so it's worth having a conversation with your doctor about that. And lastly, I want to make the important point that, again, like on a population basis, breastfeeding is great for moms and babies. But breastfeeding can cause a lot of stress. And I think that if it's contributing to depression or anxiety or mood concerns, that it's okay. Like a fed baby is a healthy baby. A breastfed baby is a gift to that baby and to that mom, but it's not always possible.
Our guest today, Dr. Jennifer Summers, family physician and lactation consultant at GLFHC. Let's talk about GLFHC for a few minutes. What are some of the programs that GLFHC offers moms to be when it comes to breastfeeding?
So we have we're very lucky in our community. Most of our moms deliver at LGH, where we have lactation consultants in the hospital that serve them there. And then at Greater Lawrence Family Health Center, I have a breastfeeding clinic on Monday afternoons that runs a couple of times a month where moms and babies can come and see us to problem solve breastfeeding problems. We also have a lactation counselor as one of our nurses that does some of these lactation visits as well. And then on Tuesday afternoons, a couple times a month, we have a Zoom breastfeeding support group, which is a lot of fun. It's where moms in the community can come and talk to each other, help problem solve, try to make plans, and also have some social time, which has been missing in the COVID era.
This might be a sensitive question. Greater Lawrence serves multiple communities, and I'm not talking about on a map. I'm talking about the Latino community, the Anglo community. Are there any stigmas in the Latino community to breastfeeding?
I actually think both communities, both the English community and the Latino community or the Latinx community, have similar stigmas towards breastfeeding. I think everybody worries if their baby is getting enough food in the first couple of days. And when you feed directly at the breast, it's difficult to tell how much the baby is taking. And so I try to reassure patients that that's normal, and all we care about is that the baby has regained their birth weight at 2 weeks of life and then is starting to gain regularly after that. And so I think that stigma of worrying about is the baby getting enough is a super common and crosses a lot of cultural borders.
This is unfortunately going to be a guy question. You mentioned it just now. How do I know that the baby is getting enough milk? I would think the baby would tell you. Am I correct?
Most of the time. But there are some babies that are kind of, I don't know, it's maybe not a nice thing to say about a baby. But there are some babies that are maybe a little lazy, and they would be just content to sleep the day away. And sometimes those babies don't feed as well and don't take as much. And those are the babies that we need to catch and watch closely.
Do breastfed babies have to eat more often?
Not in the first couple of weeks of life, usually, but that's an interesting question that you ask, because formula-fed babies tend to take higher volumes less frequently than breastfed babies do. So a breastfed baby will continue to take somewhere between 2 and 4 ounces of breast milk until they're like, I don't know, 10 months old. For feeding. That's the same amount that they take from, after about a month, because it increases slowly. But formula-fed babies will start with taking 2 ounces every 2 hours or so like that, and then go to 3 or 4 ounces every 3 hours. And then sometimes you'll have some parents that feed a baby an 8-ounce bottle of formula 3 or 4 times a day, and that's all the baby takes. So there is a little bit different in how much the baby can take at a time. I'm not exactly sure why that works that way. I actually suspect it's more related to like how much breast milk mom can store in her breast at a time. Okay. And maybe there's a variety, like maybe some moms can have 8 ounces in her breast and she doesn't have to feed as often. And some moms can only have 3 or 4. So it varies a little bit, I think.
Okay. The programs you mentioned.
Answer.
I'm sorry?
That was a long answer, Mark.
No, that was fine.
Okay.
The programs you mentioned that you're in charge of, do you have to be a patient of GLFHC to be part of those programs?
Yes, you do have to be a patient of GLFHC to be part of the programs. But in the area, WIC is a huge proponent of breastfeeding and has a lot of breastfeeding support. They have breastfeeding peer counselors and they have lactation counselors. So there are outpatient support for patients that are not GLFHC.
And if someone wanted to get more information about the programs, how can they get in touch with you, or how can they find out more about the program?
I think the best way would be to email me. jennifer.summers@glfhc.org. But otherwise, I think you can just call the clinic and ask for an appointment if you wanted something like that.
All right. Dr. Jennifer Summers, thanks for being a guest on Pulse on Health.
Thank you.
Just a reminder, you can hear all of our podcasts via our website at glfhc.org. Just click on the link about halfway down the page, and it'll take you to all the podcasts. Until next week, I'm Mark LeMay. Have a healthy week, everyone.